Hi, I just wanted to make a quick video to talk a little bit about my thyroidectomy. Um, I'm about 1 day post-operation. I had the operation yesterday, July 15th, around 8 a.m. And I know that watching some videos online ahead of time really helped me prepare myself for my surgery. So I hope that this can be helpful and answer a couple questions for people who are considering or who are scheduled for their thyroidectomy. So yeah, just a little backstory. We've known that my thyroid needed to come out for quite a while, so I've had a lot of problems with it and ended up having a biopsy in March that came back with one of my nodules being papillary carcinoma. So, and there was 12 nodules on mine, so it definitely needed to come out. And just finally found a doctor who was willing to, or an endocrinologist who was willing to refer me for surgery, which I'm really thankful for. I was very apprehensive beforehand, you know, the thought of the scar and everything, and my scar ended up being a little bit bigger than I thought, but even just being 1 day post the operation, I am so happy that I had it. I already, even though I'm swollen and still in pain, I already feel the relief of not having my thyroid, you know, pushing in my neck, especially this side it was very enlarged, and that was just kind of a pain to live with. So I'm already feeling pretty good about that. So yeah, I just wanted to make a little video about what to expect when you head into the hospital for your thyroidectomy, and what to expect afterwards. So they usually have you check in a couple hours before your procedure, excuse me, so you can just verify your insurance information. They'll go over your medical history with you again, and have you change into your gown and everything, and then probably start an IV, and that should be the last step before your surgery. I thought that they were going to give me something to calm me in my IV, but my anesthesiologist actually told me that they don't usually do that. They want you to be able to walk yourself to the operating room, so they don't usually do that until you're in that room. And so that is what we did. We walked to the operating room. I had to say goodbye to my husband at that point. He had been waiting with me all morning, and he went off to the lobby to wait, the surgery lobby, and I walked with my anesthesiologist back to the operating room. And once in the operating room, I laid on the table, and I remember them putting all the sticky monitors on me, and I remember them putting something in my IV to calm me, and then last thing I remember is taking deep breaths. I believe it was of the anesthesia, so they put a mask on your face and tell you to be taking very deep breaths, and I did that, and then I was out. I woke up in the PICU, which I believe stands for Patient Intensive Care Unit, but I could be wrong. Your family members are usually not allowed in this area, so my husband was still waiting, although my surgeon had called him to update him about my surgery, and just told him that it went well and everything, and we got the whole thyroid out, and that I did have to have a drain, and explained that to him and everything. So I remember meeting my surgeon in the PICU. He came and told me about the surgery. I remember that vaguely, and then I fell asleep, and I woke up about an hour later, and I was pretty upset that my husband wasn't around, so they told me I could get a room. They were getting a room ready for me, and then they got me my permanent room ready and wheeled me down there, and my husband met us there. So total time was about 4 hours that he was waiting for me. That includes the surgery and the recovery time in the PICU when he couldn't see me. So I was definitely relieved to be back with him again. And I felt pretty good yesterday after the surgery. I think when you're still just coming out of anesthesia and it's pretty numb still in your neck, you're really not feeling the full effects of it yet. So I was up walking around, and I was able to eat a little. I had some broth and tea, and I was drinking and doing a little bit of my head exercises. I found online some head exercises that you can do that help with healing, and I actually think they really helped. So I'll try to post that link to the exercises down in the comments. So anyways, I was feeling pretty good, and we just kind of hung out yesterday. I drank a lot of broth and a lot of tea, and we watched some shows and talked and just spent time together, and everything was pretty good. I was really exhausted at the end of the day. So my surgery time was or check-in time was 5:45 in the morning. So I had been, I hadn't really slept much, and I'm very tired last night. So I fell asleep for a while around 9 o'clock, and then I woke up about 10 or 11 with my face and my lips feeling really numb and tingly, and I guess that's the sign of your calcium dropping. So I let my nurse know that immediately, and they had already taken my IV out, but they had to put another one in to get me going on some calcium drip, and then they had to do some labs. So I got my blood drawn about 4 times last night, which I'm not gonna lie, that was probably the worst part of my whole hospital stay, because it was a lot of poking and I was really tired. So between that and then they had to stay on top of my vitals because of the calcium issue, I really didn't get much sleep last night. And so this morning when I woke up, my calcium was back to normal, and they didn't have to do my vitals or blood work for quite a while, so I got a good stretch of a few hours of sleep in there, which was really nice and helped me feel really good when I woke up. And then I woke up to my surgery team, my surgeons coming in, and just going over the surgery one more time. They explained that my dissection labs should be back within about a week, and that, everything went great, and my incision's looking really good. They told me my drain, I had a drain coming out and attached to my shirt, and it wasn't really filling up anymore, so they said that there's no need for that anymore and they could take it out. So I'm not gonna lie, that was a little painful. That was really uncomfortable and weird feeling. It's sewn into your incision, and so they have to clip out. They just cut where it was sewn, and then they pull the line out, and mine was pretty far in there. It was, wrapped up, so it was kind of uncomfortable, but definitely relieved that that's out, because it's kind of a pain to sleep with and have in you and everything. So yeah, that went well. And then they told me that I had my discharge paperwork going through because I was doing so great. There was no reason to stay any longer. So that was just a couple hours ago, and now I've been home for about an hour, and I'm feeling pretty good. I think I'm taking Norco or something like that for pain medication, and I've been able to cut back from 2 pills every 4 hours to 1 pill every 5 hours, and so that's really good. Just trying to, wean off that a little bit so I don't have to be on it so much. But that one really helped. Percocet is what they wanted to prescribe me, but that tends to make me a little sick to my stomach, so I didn't want that. And also I have a patch behind my ear. I know that I have motion sickness and nausea problems, especially with prior surgeries. Previous surgeries I've had extreme nausea when waking up, so this patch really helped me not get that this time, and I think it lasts 72 hours, so it's still on there, and they told me I can take it off tomorrow. And yeah, so other than that, I think I have to follow up with my surgeon in a week, and the stitches are all interior stitches inside, they're not on the outside, and I guess they will go away on their own. I don't have to do anything, and this tape will just come off within the next couple of days by itself, so no care really for that, just no touching it, no, you don't have to really wash it. It's okay if it gets wet, they said, as long as you're not submerging it. It's okay if it gets wet in the shower. And so yeah, other than that, I'm on some calcium pills, which I think is just standard, and they gave me some thyroid that I need to start taking tomorrow. I have my pain medications, and I have some stool softeners because the anesthesia and pain medications have really kind of made me constipated, so I'm going to start taking those today. And otherwise, I'm feeling really good. My voice, it's a little raspy from the tube that was in my throat during surgery, and so it's a little sore from that, but I don't have any voice issues or obstruction to my voice, and I have pretty good movement of my neck and my mouth. So I just wanted to make a video just showing that it's not always so terrible of a recovery, and that the pain is definitely manageable, and it's definitely worth it. I'm 100% happy that I had the surgery done, and yeah, and I had a great team. Again, I don't know if I mentioned, but I was at the Swedish hospital, First Hill in Seattle, and my surgeon, everybody from my surgeon to his team to the nurses I had taking care of me, they were all amazing. They were so helpful, and just a really great hospital that we had a really good experience there. That was my first time going to that hospital. So yeah, we had a really great experience, and yeah. So I guess that's it. I'll show a little bit of the incisions. Just over here is where the drain was, so that's why it's covered up. They said it might drain out a little bit more now, but that's fine. And then yeah, it's a little bit bigger than I thought, than we were anticipating, but then he told me my thyroid was a little bit more enlarged than he thought originally. So yeah, so I hope that answered some questions and just gave you an idea of what to expect when you get into the hospital for your thyroidectomy. Thanks, bye.